All right, good afternoon and welcome to our webinar, How Move Your Way Impacted Physical Activity Outcomes in Communities Across the United States, hosted by the U.S. Department of Health and Human Services Office of Disease Prevention and Health Promotion. My name is Katie Costello. I am an ORISE Health Communications Fellow here at ODPHP, and I'll be moderating today's webinar. So before we get started, we just have a few reminders for today's presentation. Closed captioning is available on your Zoom toolbar. You can click Show Captions to turn these on. You will be muted for the entirety of the presentation, but you are able to put any questions you may have for our presenters today in the chat or Q&A throughout the presentation, and we will have time for a Q&A at the end. Today's webinar will be recorded and available on ODPHP's YouTube channel for your viewing pleasure, and we will send that out once it is available. And finally, a post-webinar survey will be available in your browser after the webinar ends, so please take a few minutes to respond. So it is now my great pleasure to introduce Dr. Katrina Piercy, the Director of the Division of Prevention Science, as today's speaker. She is a clinical exercise physiology and a registered dietitian. She leads all federal physical activity policy efforts, including serving as the lead for developing the second edition of the Physical Activity Guidelines for Americans. She also had a large role in the development of the Move Your Way communications campaign to ensure the science was translated accurately for consumers. She'll be joined for the Q&A section by Kate Olskamp, who was the federal lead for Move Your Way for several years. And so with that, I would love to pass it over to Katrina.
Wonderful. Thank you so much, Katie. Good afternoon, and welcome to this webinar from the Office of Disease Prevention and Health Promotion at the U.S. Department of Health and Human Services. I'm delighted to be here today to share the results of our Move Your Way pilot evaluation with all of you. In our previous webinars, we've introduced the campaign and heard from representatives from communities who participated in our pilot test. Today, we'll cover a brief overview of the campaign and the community playbook before we dive into the results of our outcome evaluation. We'll wrap it up with some information about how you can learn more and have some time for question and answers. Feel free to use the Q&A feature at the bottom of your screen to submit questions throughout the webinar, and we'll also have time to answer them for myself and Kate Olskamp at the end. Many of you may be familiar with the Dietary Guidelines for Americans, or the Physical Activity Guidelines. What are they based on? So to back up from the beginning, the government develops these policy documents based on a summary of the science developed by an external group of experts called an advisory committee. They detail these findings in a scientific report, which is delivered to the secretaries of HHS for the Physical Activity Guidelines and HHS and USDA for the Dietary Guidelines. The guidelines are written for health professionals and policymakers, so there's a need to translate the guidelines one step further to consumers. And that's where My Plate and Move Your Way comes in. These resources are designed to take the science and put them into information that everyone can understand and use, no matter their age, abilities, health status, or fitness level. These communication campaigns focus on small changes and actionable steps to help guide behavior change. While we have very clear and strong evidence about the benefits of physical activity, awareness of the guidelines, knowledge of the key recommendation, and levels of people actually meeting the guidelines are unfortunately quite low. There are also disparities in physical activity levels when it comes to age, race, ethnicity, and socioeconomic status. As you can see from this slide here, only about 20% of US adolescents and a quarter of US adults actually meet the physical activity guidelines recommendations. So we're talking about 150 minutes of moderate intensity physical activity each week for adults and 2 days of strength training. For youth, it's 60 minutes or more of physical activity each day, including vigorous muscle strengthening and bone strengthening activities. These low levels of adherence to the guidelines highlight an ongoing need to promote physical activity and communicate the recommendations to the public. So that's essentially why HHS created the Move Your Way campaign, to promote the key parts of the physical activity guidelines to the public. To better introduce the campaign, I'd like to share this short video.
Get to know the Move Your Way campaign. People in our communities need physical activity to be healthy. And the Physical Activity Guidelines for Americans clearly states how much activity people need based on the latest science. But most people still aren't getting enough. And that's where Move Your Way comes in. Move Your Way is a national campaign launched by the U.S. Department of Health and Human Services to help Americans get active. The Move Your Way campaign adapts the physical activity guidelines into information everyone can understand and use, no matter their age, abilities, health status, or fitness level. Move Your Way aims to reach people who aren't active enough yet, but who are thinking of making a change. And to reach them, Move Your Way is changing the conversation about physical activity. Being active has great health benefits, but for many people, getting active isn't easy. They're surrounded by messages that make physical activity feel unachievable, overwhelming, and all or nothing. Move Your Way shows how manageable and adaptable physical activity can be, and how to work around barriers like lack of time or access to facilities. Move Your Way means lots of things count as physical activity, even everyday tasks like cleaning your house and walking your dog. It all adds up. Even a few minutes of moving more each day has real benefits. Find activities that work for you, so it's easier to stick with them. Move Your Way is ready to use with a suite of fact sheets, posters, videos, and interactive tools tailored to different audiences like older adults, parents, kids, teens, and pregnant and postpartum people, and based on people's needs. Move Your Way materials are tested with diverse groups of people to make sure they're clear, informative, and accessible. And all materials are available in English and Spanish. It can be hard for people to get active on their own, and that's where you come in. Community organizations like health departments and nonprofits can use Move Your Way to help their communities get active. You can make Move Your Way work for your community, whether that means starting a brand new local initiative or using Move Your Way materials in your existing activity programs. Do it your way. Plan events, big or small, that make sense for your location. Use Move Your Way's ready-made materials or adapt them for your community. Post Move Your Way's grab-and-go social media messages and graphics, or start your own social media challenge. And you don't have to start from scratch. 10 communities across the US tested out Move Your Way with events, new programs, and social media messages to get people in the community moving. Their experiences helped inform a community playbook with tips and materials to help communities of any size, location, or budget promote physical activity. The playbook has resources to help you do things like plan community events, build a budget, work with local schools and businesses, everything you might need to bring Move Your Way to your community. You can find the playbook on health.gov as part of the Move Your Way Community Resources website. Here's how 3 community partners describe their experience with Move Your Way.
Move Your Way is really key to active Southern West Virginia's health education efforts. It gives us a way to interact with our audience online and through partnerships. We use the community playbook to identify partners and work with them on a health education campaign. For example, we partnered with a local library in a small West Virginia town to add an obstacle course to their bookmobile program, and then to distribute the Move Your Way fact sheets for kids. Now kids can get their dose of physical activity when they come to get books and use the free Wi-Fi.
Before Move Your Way, the Siouxland District Health Department used different campaigns, curricula, and programs at the same time. Having one message has made our work easier and more impactful in the community. People now see Move Your Way and know what it's all about. For example, we partner with local healthcare providers and clinics to reach pregnant and postpartum people. We distributed over 2,000 bags with Move Your Way fact sheets and goodies to expectant parents in our area.
The Move Your Way resources were easy to adapt for our organization's needs. The Southern Nevada Health District serves just over 2 million residents, many of them native Spanish speakers. We were able to pick and choose what we needed and find fresh ideas to reach our communities with voices they trust and are ready to engage with.
Now it's your turn to move your way and get your community moving too. Find all the Move Your Way resources at health.gov/moveyourway/community resources.
Now that you're familiar with the Move Your Way campaign and how the Move Your Way community playbook was developed, we're going to dive in and discuss the research surrounding the community-based implementation strategy. So for the remainder of the webinar, I'm going to discuss the results of an evaluation of the campaign's community-based implementation strategy of the pilot sites you just heard about in the video. More information can be found, as you see on this slide. This is the information from the publication that I'll be referencing, as well as a QR code. I believe they'll also drop that into the chat, so you can pull up the article, which is open access if you want to learn more about some of the research pieces. So as we just shared, over the last several years, HHS conducted a health communications campaign pilot study to implement and evaluate the implementation of the Move Your Way campaign in local communities. Starting back in 2018 and 2019, we started with a health education and communication firm that worked closely with 2 health departments in Jackson, Mississippi and Las Vegas, Nevada, to plan and implement the campaign locally in those areas. The collaborative effort included identifying, executing, and evaluating implementation strategies and developing a Move Your Way community playbook, which we've been iterating on. You can learn more about the experiences of these first communities in a health.gov blog and a previously recorded webinar that we did. And I'll have QR codes with links to everything at the end of the presentation. To further evaluate the campaign's work, we piloted the program in an additional 8 communities throughout the United States in 2020. These are shown in the red dots here, along with the green dots, which showed the 2 previous ones where we started in Jackson, Mississippi, and Nevada. ODPHP used a variety of criteria to identify these 8 additional communities, including self-selection after an informational webinar, recommendations from federal colleagues. We were really looking for diversity in the type of lead organizations, so local health departments, recreation and park districts, physical activity nonprofits, as well as diversity in the geographic location and community sizes and types, thinking about urban, suburban, rural, really trying to get this out there to as many different types of communities to test out Move Your Way. We also consider whether the communities had demonstrated need based upon county level data on physical inactivity, and whether the organizations had the capacity to lead and execute the campaign implementation. So thinking about some of their staffing, leadership support to do a project like this. The presence of a pre-existing coalition or partnership network related to physical activity, health, or overall wellness was another factor that was considered into making these selections. So this slide is showing you the pilot community characteristics. We had calls with 11 potential communities to determine interest and the capacity. And then we sent formal letters of invitation to 8 communities, which all agreed to participate and signed contracts with our communications firm to agree to do this work. The pilot selection happened in November of 2019. So a lot of work was happening in early 2020, in January and February, to kind of plan things out. And we all know what happened in early 2020. So there was a lot of work that was started and a lot of groundwork that was laid. We made a lot of adjustments in COVID, but we're still able to pull all of this off and do the campaign and the implementation into March of 2020 through October. So we made some adjustments for some of the initial plans, but it's still important to share some of these findings, some of the opportunities, and some of the pivots that took some of this virtual to still send this information out. There are several resources that supported the campaign implementation, some coming from ODPHP, as you can see on the slide here, and some from the community itself or that lead organization. On our side from ODPHP, we provided some financial support, technical assistance, and the campaign resources themselves. Communities came into this with someone that could serve as a Move Your Way coordinator, staff support, as well as the engagement of community partners to think about how this could be brought on a larger scale. Our financial support included nominal reimbursement for campaign expenses. So this would be things like printing costs, event fees, equipment. We also procured geographically targeted advertising in each of the communities to further the reach of this work. We provided technical assistance throughout the planning and the implementation stages. And as you can imagine, some of this adjusted as we all navigated the early times of COVID and what may work to be able to do this. So there were monthly check-ins with each organization, and then we had 10 group calls for facilitated discussions so that everyone could be learning from one another throughout the process. We also provided campaign resources, including the Move Your Way Community Playbook, campaign posters, fact sheets, videos, social media graphics, and images, the consumer microsite, an interactive tool for parents, and the online activity planner. So a number of tools and resources, as we mentioned, that were offered for the communities to use and tailor to what works for their needs. All of the campaign materials and messages sent everyone back to the Move Your Way website, so that's health.gov, playbook.org/move your way. This site in general, right now we have over 80 resources in English and Spanish. It provides information about the benefits, the types, and the recommended amounts of physical activity tailored to different audiences. The organizations themselves provided at least one Move Your Way coordinator. So this tended to be a mid to senior level staff member whose job responsibilities involved managing similar programs or initiatives. And often they had a group of staff that could provide support as well. The supporting staff tended to be communications professionals, contractors that may be coming in to help support the campaign. And then the big piece of this was also that these communications either built out or tapped into an existing local partnership network. So this was really a key piece to ensure that the campaign could reach the different audiences in the target communities. Partners ranged from other health and wellness focused organizations, so things like the YMCA, local fitness centers, hospitals, organizations more on public services, so thinking about schools or libraries, and of course, community entities themselves, so local businesses or membership organizations. We really try to think about how do we get this out as broadly as possible to all of the potential groups that might help meet the needs of the communities that they're serving. One of the key inputs provided was the Move Your Way Community Playbook. It's the implementation guide for our campaign. The playbook is located on health.gov and it walks you through how you could actually implement the campaign. Let me turn on this quick video and it'll walk through what's happening on our website. So all of the resources, as I mentioned, are on the page. It's split into 3 sections, phase 1, phase 2, and actual resources. There's an About the Playbook page, which provides us an overview of what it is and what's included. Phase 1 is the aspects of planning and strategy development. So this is kind of an overview, what we did for the community pilots, how to go ahead and get things started. So in terms of setting priorities, goals, metrics, and implementation strategies, how to delegate key tasks, how to build up the team, thinking importantly about securing funding and volunteers, and how all of this campaign will be kicked off in terms of launching pieces. The second phase talks more about the implementation and the evaluation. So how to get this materials out to the public, how to host community events, how to help spread the word, and to evaluate some of the challenges and successes. And then finally, there's a number of resources to help plan, implement, and evaluate community campaigns. So including there's a campaign implementation tracker, an intercept interview guide. So post an event to kind of be able to grab some individuals and check in and get some initial pulses from that, and some tip sheets for partnerships. So each of these, and I should say this at the start, all of this is federal government resources that are free to use and available to download and share. And so part of unpacking this and going into all of the details in the community playbook is that someone else could pick this up and take this into their community and would have all of the tools at their fingertips. So now I want to tell you a little bit more about some of these pilot sites and some of the different activities that they did. As I mentioned, we targeted a number of different sites, thinking about the geographic diversity, the type of community that they were set up in, the types of population they may work with. So each community did some different works in terms of implementing Move Your Way. The implementation officially began. This was our kickoff on March 1st, 2020. That was just weeks, as you all know, before things really were going with COVID-19. So that adjusted a lot of our work. We did have 2 organizations that had in-person campaign launch events that happened in early March, but obviously by late March, we were all in a different state and everybody kind of sheltering in place. So everybody made some adjustments. Some organizations experienced some limited capacity for doing the campaign activities because their organization needed to shift to focus on COVID-19. But all of the pilot sites were able to do continued implementation and really came up with creative ways to make things work, thinking about how to do things online, engage people virtually, and ensuring that safety was paramount in all of this. One of the pieces I mentioned that ODPHP covered was online and social media ad buys. Those were set up on Facebook, Instagram, Google Display, YouTube, and Snapchat. We looked at the zip codes that were served by the lead organization, and so that is where the targeted ad buys were set up. The ads were set up to encourage people to get more physically active and to also connect them with local resources that could support physical activity. And then social media platforms were used in each community depending on the community itself based on audience and budget. So let me walk you through some of these pieces. Starting first in Cabarrus County, North Carolina, they did a virtual launch event with a step challenge and physical activity trivia, a pop-up socially distanced event at a local baseball stadium. They also distributed resources along a local walking trail, and they did promotional campaign information before videos at drive-in movies. In Chicago, Illinois, they did a virtual launch event featuring online fitness classes. Their focus was a lot on the teen community, so they did an active teens event. They collaborated with local libraries for a day of play and also did a free family run event. In Columbus, Ohio, they did a community bike ride. They distributed bike helmets for youth and did a walking jamboree. Fairfax County, Virginia, they did more than 200 virtual fitness classes. They also put out educational signage posted in public parks and community areas, and they collaborated with Safe Routes to School to strengthen that relationship and share information through those resources. Sioux City, Iowa, they did an in-person Winterfest launch event. So they were the ones that were able to get a launch event started before things really got going with COVID. They did a social media scavenger hunt, a virtual workout series, and built environment challenges. So they added mile markers and signage around their community. So one of the ways to do this, if you know there is a destination up ahead, but to provide some information ahead of that saying, hey, if you want to get to the X location, it is a 1/4 mile walk, thus encouraging people to maybe to take a few more steps and go see this destination as opposed to maybe hopping in a car. Southern West Virginia, they created a virtual kids run club, a regional fun run, a touch-free obstacle course for kids, and did some collaborations with the local library. Streator, Illinois, this was the other one that was able to do an in-person launch event. They also did a community scavenger hunt and did a number of social media challenges. And then Wyandotte County, Kansas, they did a social media bingo card activity challenge, material distribution and a partner youth event, and they did a public school Summerfest activity. So during this campaign implementation, the pilot organizations distributed Move Your Way messages, materials to community members. They were helping to drive traffic to the Move Your Way microsite and activity planner. And they also hosted events that promoted or provided opportunities for physical activity in their community. So we wanted to test to see how does this work and how does this maybe change those that were exposed to Move Your Way. So to evaluate how we did this, we worked with a consumer opinion panel, Gallup poll, to conduct an online cross-sectional survey of each of the 8 participating communities. We did this for a total of 6 weeks. So this happened November 13th through December 23 of 2020. And this followed the end of campaign implementation, which went from March through October. We collected a good bit of data on the respondent characteristics, mainly thinking about the exposure to the campaign, awareness of the guidelines and knowledge of the guideline dosage, recent behavior change and behavioral intent, physical activity self-efficacy, and physical activity behavior. So I'm going to walk you through each of these pieces, but want to just kind of lay the landscape of some of the data that we were collecting and trying to see where there might be differences. In terms of the statistical analysis done on this, the differences between exposed and unexposed to the campaign were compared for continuous variables reported by physical activity behavior and physical activity self-efficacy. So we used t-tests and one-way ANOVA, where Tukey's correction for multiple comparisons where applicable. Differences between groups were compared for awareness of the guidelines, knowledge of the guidelines dosage, recent behavior change, behavioral intent, and meeting the guidelines using chi-square tests. Statistical significance was defined as a p-value as less than 0.05. So let's dive in. One of the big pieces we're starting with was exposure to the campaign. So we asked a few questions. Have you seen, heard, or read anything about the Move Your Way campaign in the past 6 months? Asking a yes/no response. Or have you seen this Move Your Way logo, as you can see up on the screen, for the past 6 months? Again, yes, no. This gave us a dichotomous exposure variable that was created. We coded respondents as exposed if they answered yes to one or both of the recall questions, and unexposed if they answered no. Now, diving into awareness of the guidelines, asking, have you seen, heard, or read anything about government physical activity guidelines? Yes or no were coded. Those who responded yes were coded as being aware. No was coded as being unaware. Same thing about knowledge. We were looking at knowledge of the aerobic portion of the guidelines, the 150 minutes or more each week. And so same thing here, that we are judging yes would be someone who is aware, and no would be unaware. Same thing for strength training. We're looking at at least 2 or more days on that component. Recent behavior change was asking participants to think back about the last 6 months. Since then, has your physical activity increased, decreased, or stayed the same? And then thinking about behavioral intent. So how likely are you to become physically active in the next 6 months? Also looking at self-efficacy, because that's a big component when we think about encouraging people to be more physically active, how they feel about being able to do that. So the main question was, how confident are you right now that you could be physically active often enough to stay healthy if, and you can see all of the bullets here on the slide. Keep in mind, we were asking this question in November to December. So there are some limitations to the timing of when all of this was happening. So thinking about weather being one of those, some of the geographic areas of the country, Chicago and others that were already probably having some snow on the ground. So that could impact some of these findings as well. But we asked everybody to look at all of these and as potential barriers to help code for self-efficacy. Physical activity behavior in itself was trying to test how much physical activity individuals will get. So we're asking about the number of days a week that they typically perform aerobic physical activity, at least moderate intensity, and the average minutes. So that number was calculated for the aerobic amount. And then the same thing for muscle strengthening, asking how many days a week. When comparing those who did not report exposure to the campaign, those who were exposed to Move Your Way. So reminder, exposure is someone who indicated that they had heard about the campaign or seen the campaign logo. Those who were exposed had higher level of awareness of the guidelines, knowledge of the dosage. They were more confident in their ability to be active despite the barriers. So that's self-efficacy piece. Higher intention to become more active, an increase in their physical activity over the last 6 months, and more likely to have met the muscle strengthening physical activity guidelines dosage. So this is kind of our overview snapshot, which essentially tells you that, at least from our findings, that we saw a very positive response for individuals who were exposed to the Move Your Way campaign. Breaking this down a bit further, the total sample size for our pilot evaluation was 5,140 individuals. Our main goals for the campaign was to promote the guidelines and its recommendation. So thinking about some of the awareness and the knowledge, and then also that behavior shift is the end goal. So here, this is looking at this slide specifically, the awareness piece, and then correctly identifying the dosage. So we have overall found low rates of awareness or knowledge of the specific numbers. So as you can see here, about 22% of the respondents had reported that they've seen, heard, or read about the physical activity guidelines. This is kind of in line with other data that we've seen in terms of actual awareness of the guidelines themselves. But when we start looking at some of the dosage pieces as well, for the aerobic dose, for example, those who had been exposed had a 3.4 greater odds of identifying the current dosage recommendation compared to those unexposed. An interesting piece with this part, so as I mentioned, the dosage is 150 minutes or more each week. There is a historical dosage. So some of the first editions of the guidelines that CDC and ACSM put out in 1995 recommended 30 minutes a day, 5 days a week, which if you do the math is also equal to 150 minutes. So we also had that as a potential response. And it seems that dosage is something that there is still high awareness of that, because that was the second most responded answer for that. Even though they mean the same things, there's an important reason why we talk about the dosage as 150 minutes across the week. That's based on the science that tells us that it's a cumulative benefit of physical activity. You could do 30 minutes 5 days a week. You could also do 10 minutes one day and 60 the next and 15 the next, and it could be all broken up. And so that's why the guidelines recommendation is in a weekly amount, although that number 150 feels big. Part of what we do with Move Your Way is try to break that down and talk about, if you've got 5 minutes here, here's how to start it. Thinking about muscle strengthening, those who were exposed had 2.9 greater odds of correctly identifying the muscle strengthening recommendation. So as you can see here, The far column is the exposure, which had greater numbers compared to those who were unexposed. Then looking at self-efficacy barriers. So I mentioned we had 10 components here. So 10 was the most confident that they could be active in face of the barriers. Overall, the mean and standard deviation for the physical activity self-efficacy score was 5.1. Those who were exposed had a higher combined score. This was statistically significant of 5.7 compared to unexposed of 5.0. So slightly higher on the self-efficacy to be able to be active in light of some of those barriers. Thinking about behavior change and behavioral intent. So really what we want to be doing at the end of the day, yes, awareness and knowledge of the guidelines is wonderful, but are we helping to move people into making some of these behavior changes? 21.4% of respondents reported an increase of their physical activity over the previous 6 months. That is in contrast with about 44% making no change of this. And then about 34% had a decrease in physical activity. So again, seeing exposure to the Move Your Way campaign, those indicated that they were more likely to have increased the amount of activity that they were doing over the last 6 months, and that they were more likely to increase their activity over the next 6 months. So they were thinking about doing more even moving forward, which is great. There were significant differences between exposed and unexposed for self-reported physical activity variables. So this is where we're asking individuals how much physical activity over the course of the week, how many minutes, roughly how many minutes per session, how many days per week for the aerobic side, and then how many days a week for muscle strengthening. This is one that was kind of interesting. If you look at not exposed and exposed, the not exposed is slightly higher. This wasn't significant, but we do see a slight difference here in 225 minutes per week compared to 202 minutes. But we look at muscle strengthening activity, those that were exposed were more likely to meet that goal of 2 or more days of muscle strengthening activity compared to those who were unexposed. Then looking kind of the combined piece. So when we talk about meeting the guidelines, we're talking about the aerobic component and the muscle strengthening component. So if you look at the full sample of that, about 30% of all respondents were meeting the guidelines recommendations, which is roughly similar. Right now, the national data is about 25% of adults are meeting both the aerobic and muscle strengthening. When we start to tease this out between exposed and unexposed, we see a higher number of exposed that were meeting the muscle strengthening. So that's down here. Green is exposed, gray is the unexposed area. So just to orient you back to this chart, this is the aerobic recommendations here, muscle strengthening, and then combined aerobic and muscle strengthening. So the full guidelines as the last one here. So biggest increase or biggest difference that we were seeing actually is between exposed and unexposed was really around the muscle strengthening component of the guidelines, which is great. So let me shift gears a little bit more as to what does this all mean and what are we doing moving forward from here? So some implications from practice and kind of next steps on this. Physical activity advocates and researchers have long called for improved communication strategies and the development of a national physical activity campaign to educate and motivate Americans to get moving. As I shared at the beginning, we have fairly low rates of less than a quarter of Americans who are meeting the guidelines. And there's been a call for some time of coming up with a way to break down the guidelines and help people actually get started. So this is where Move Your Way came from. By doing the pilot study, we were really trying to see if does this work. And from our evaluation, we found that exposure to the Move Your Way campaign was associated with higher reported outcomes, including awareness of the guidelines, knowledge of the dosage, intent to become more physically active, physical activity self-efficacy, and reported physical activity behaviors compared to individuals who did not report campaign exposure. So this is suggesting that increasing exposure to the campaign may help improve physical activity knowledge and the potential to promote behavior change for physical activity contemplators across the United States. I should mention too that Move Your Way was set up intentionally for the contemplated audience. So those are individuals not yet meeting the guidelines, but are thinking or getting more active over the next 6 months. So really, we've set up Move Your Way as a great tool for public health practitioners, health professionals, and physical activity professionals across federal, state, local levels to use the campaign to promote physical activity. Findings on the aerobic component of the guidelines reflect some really interesting findings, and as I mentioned earlier, kind of a connection back to some of the historic recommendations. As I shared before, that we have the first time we put out physical activity guidelines back in 1995, the dosage was 30 minutes a day, 5 days a week. And as we saw from asking that question and that being a response for some of the dosage, that there are some individuals that kind of still remember that key point about that amount. At the end of the day, the numbers are the same. If you do it 30 minutes 5 times a week or 150 minutes across the board. But the general goal is really to move people towards that 150-minute number. And so, but continuing to get out the message that any amount counts. That is one of the concerns when we say the 30-minute 5 day a week, and part of why that is not the key message in this is because for some people 30 minutes is a very long amount of time. But if we can break that down and say, do you have 5 minutes here or 5 minutes there, and maybe you have 30 minutes or a longer time on the weekend. So that's part of why our dosage is across the span of a week. Additionally, the results from this pilot can be used by the federal government to guide future physical activity promotion. And also for us to think about how we can promote and expand Move Your Way to different demographic groups. So if you think about right now, we have over 80 resources in English and Spanish. We've touched a number of the groups in the guidelines, from older adults to youth to parent, to individuals who are pregnant and postpartum, but certainly haven't reached everyone yet, and all of the population. So the findings from this type of work help us grow Move Your Way and think about how best to tailor materials moving forward. Another layer of this is thinking about some of these implications from research. As I mentioned, some of the challenges from this work as we were set to kick things off on March 1st of 2020. So there was that lens in all of this. But the other part of this is thinking about a campaign like this, the timing and the duration of this. So how much time that someone may need exposure to a campaign. For this project, we had 8 months of implementation and then collected data immediately following. Sometimes that could be impacting the results, but also thinking about how much time will someone need to be able to start making some of these changes. Future implementation and evaluation could manipulate the intervention or the time of year. As I mentioned, we were getting the survey data results in November and December, which may impact individuals' physical activity levels or their thinking of how much physical activity they're doing moving forward. Unfortunately, we didn't have funds to do additional follow-up surveys to look at this another 6 months after we finished, or even beyond that, to see if there's anything that continued to stay with participants. Also thinking about additional research to think about campaign implementation and results with different populations of focus. So focusing on different ages, genders, race, ethnicity. We really set up the campaign with broad audiences for physical activity contemplators, but you could also drill this down to more specific populations. And of course, as time continues and we have more opportunity to promote the guidelines, you know, we only have put out 2 editions. So we don't have the same track record that maybe the dietary guidelines for Americans has. But I think as we continue to share information about the physical activity guidelines, the importance of physical activity, the amounts and types, hopefully we're continuing to grow the national kind of audience awareness of the guidelines, the benefits, as well as the dosage. So that may help us see a shift in some of these numbers as well. So let me wrap this up to give you some resources and some information to learn more before we shift into some questions. This is the manuscript that was the focus for today's conversation. So if you'd like more information in some of these different data points, you can also click on the QR code. It is open access, so feel free to read at your leisure. For additional resources, everything for the Move Your Way campaign is at health.gov/PA-guidelines/Move Your Way. If you're interested specifically in the community playbook, so interested in setting this up in your community, the second link will have everything in there to walk you through. It's a great package of resources. And finally, if you want to check out the Move Your Way campaign as your audience would take a look at it. So our microsite is health.gov/Move Your Way. And then finally, I referenced earlier some of the community pilot activities. We have a blog that gives some of the key highlights. as well as a Move Your Way webinar from 2022, which talks about some of the success stories from the pilot community. So you're welcome to watch those. And last, we'd love to stay connected with you. You can follow health.gov on Twitter and at health.gov on Facebook. We have a sign up link on our website to stay up to date on information, new resources. For example, we are currently putting the finishing touches on the physical activity guidelines mid-course report on older adults, thinking about strategies for implementation in that population. So we're going to be growing some of our Move Your Way resources tailored toward older adults. So making sure you're signed up on our listserv, you'll get updates when we've added new materials or have new content. And you can also reach out and contact us. So if you have questions or are looking to implement Move Your Way in your community, we're happy to chat with you and see if there's ways that we can help support your work. And I will hand it back to Katie to shift us into questions.
Great. Thank you so much, Katrina, for that great presentation. So I would now like to introduce you all to Kate Olskamp, who is joining us all the way from Greece. So thank you, Kate. Kate was the federal lead for the Move Your Way campaign for 5 years and is also a co-author on this manuscript. So she'll be here to answer some of your questions this afternoon. So we'll take about 19 minutes to answer some of the questions submitted throughout the presentation this afternoon. So if you forgot to ask a question, feel free to submit it now, either through chat or Q&A. And we'll try to get through as many as we can. So Katrina, you can go ahead and stop sharing so we can see everyone. Great. So first question I have, and I think this can be, for either of you, who exactly were the respondents of this survey? Who was a part of that sample? Was it adults, children, specific gender? Could you just kind of elaborate on that?
Sure. So when we fielded this survey, it went out to the 8 communities who participated in the pilot, and it was exclusive to adults. There were not any kids that we surveyed. That's one thing that we found, that some of our most commonly used, commonly downloaded, and commonly looked at web pages were those related to kids and to parents. And so I think it's an interesting opportunity for future research to see, okay, how did things change when it came to either kids' knowledge or parents' knowledge of what their kids need? So that's something interesting to look at. So this was adults only. And we did recruitment in the larger cities. It was online through existing panels that Gallup had. In some of our smaller communities, we did field some physical mailers that pointed people to the online survey. We had some of the common struggles that can be experienced with recruitment. We ended up with a slightly higher educated group of respondents. Our respondents were primarily female. I think a lot of surveys find that women in the family are those who are responding. And then predominantly white. Some of that did have to do with, the communities that some of the communities that we're serving were also serving predominantly white communities, but not all of them. So that was kind of an overview of the sample, but all adults between the ages, I believe our range was 18 or 19 to 74, I think it was. But so we did range, I think the mean was right around middle age. So I think mid 40s with some swing in either direction. But up to the 70s, which is always good to have variety.
Great. Thanks, Kate. So we have a few questions coming in now. So John would like to know, have you done any health economic evaluations?
We have not looked at any economic repercussions of this work specifically. There is a lot of work out there that physical activity can reduce your health costs, can improve your health outcomes related to needing to take, variety of medications for chronic disease, things like that. That's not part of our research, but that research does exist out there. Katrina, I saw you went off mute. Do you want to
No, I was gonna say the same thing. We haven't kind of unpacked that piece specifically when it relates to Move Your Way, but there's a lot of information that exists. And there's a lot of data too that's also looking at kind of the threshold of meeting the guidelines as it relates to all-cause mortality, chronic disease risk, and morbidity. So that data is fairly well established. But we didn't pull that piece into this, but it certainly would be an interesting way to look at this and could be another angle in which to kind of sell this to a community, thinking about kind of the economic benefits, you know, the mental, social, physical pieces that a community could have if you got people more physically active.
Great, thank you both. So again, this could go to either of you. Do you all have any feedback, comments, or suggestions with engaging with faith communities? This participant has is seeing a lot of engagement and momentum with engaging with their faith communities where they're located. So any suggestions?
None of the communities that we worked with focused specifically on faith communities. I believe in the first round of pilots in 2019, Jackson, Mississippi, I believe, did engage with some faith communities. And I think also in 2021, when Southern West Virginia was back and looking at reaching out to Spanish-speaking audiences, that they also engaged a little bit with faith communities. But I also would encourage you to look at two different resources. Within CDC's Active People, Healthy Nation, they have different the different sectors of society that influence physical activity. And I know they have some resources for the faith-based institutions. And then also the National Physical Activity Plan, which comes out from a group now part of the Physical Activity Alliance. That's a non-government organization, but they have strategies and tactics for all different sectors of society for how to get people moving. And they have sector committees, and faith-based is one of those committees. And so they have experts and researchers who are the leaders in implementing physical activity interventions through faith-based organizations. And that would be a great place to start. Even some of the names on that committee might be great people or researchers to look out for, or to see what work that they've done. Katrina, anything to add there?
No, I just dropped the link for the faith-based sector into the response for the Q&A, so you could see that piece. But again, I think we've covered Move Your Way and as many audiences as we could work with initially to kind of put this out and test it, but we certainly haven't hit the gamut of it. And faith-based is a great one. There's also the opportunities with that to kind of have the social part of being physically active and kind of really fostering that community piece. And for many individuals, that's what motivate them to be active, is because they know there's someone else there. They're doing it collectively with a group, with a community. So I think that's a great population to work with. And like Kate said, the faith-based sector has some great strategies and approaches for how to work with them.
Great, thank you both. So Kate, you mentioned the 2021 pilot evaluation with Southern Nevada Health District, where it was primarily focused on Spanish-speaking audiences. So what did you learn about the physical activity knowledge and behavior of the Hispanic community? Was there any research done in that area while completing that pilot?
Those are great questions. The evaluation that we set up in 2021 was a little bit different than 2020. We had less communities and less kind of overall funding. And so we didn't field the same type of survey. So we don't have similar types of data from us, but I know that other groups have looked into that. I can't off the top of my head remember if this has been published, but I know that there's been some research out of the University of Nevada, Las Vegas, and there's some other groups that are really looking at physical activity in Hispanic communities and knowledge and awareness there. So this information that we had out of this group of about 5,000 people, we looked at in aggregate. We did not have enough respondents to be able to look at specific demographic groups. So I can't answer that in more detail, but it's something that we know is really important. especially with health disparities and, there are physical activity disparities by race, and those are things that we as a field, and I know HHS and ODPHP are, bent on trying to change and trying to improve.
Great, thanks, Kate. So another question that might be relatable to the 2021 pilots. Did you develop any specific brochures for pregnant women and new mothers that were distributed or delivered?
Yes. So in 2020, while all these pilots were going on behind the scenes, ODPHP was working to develop resources for people during and after pregnancy. And all of those resources are available at the same links that Katrina and Katie have been sharing. They are on the website. There are specific audience for during and after pregnancy. Those were all tested with a variety of individuals before and during their development to make sure that they really spoke to the experiences that people have during that really kind of important time in like a health journey and in life. And so Sioux City in Iowa returned in 2021 and really did a pilot focused on this population. And I know there are some blog posts on health.gov, and they returned in a previous webinar and shared some of the work that they had done specific to during and after pregnancy. And then there is an upcoming manuscript coming up for the Journal of Midwifery and Women's Health, I believe it is, that'll detail some of the research that went into building those resources. So that's not available yet, but is coming soon. And if you're on the ODPHP listservs, they'll definitely be able to share all the publications that come from this work will be open access and available regardless of your ability to connect to academic library or anything like that. You'll be able to download those for free. And I see Tim Bungham, who's a researcher at UNLV, did message us and say that the manuscript from the work specific to the Spanish-speaking community in Las Vegas is under review. So more to come on that as well. Thanks, Tim.
Great, thanks, Kate. So Katrina, on the overview slide of all the pilots, some of them were rural and suburban communities. So what was that experience like working in the rural communities, and did you work with anyone like farmers?
Yeah, so there was a really intentional setup to selecting these different pilot communities and knowing that people receive their information in different ways depending on kind of geographically where they are. And so that was part of the focus to get a diverse set of communities that are working more with urban, suburban, rural. I think COVID also changed a lot of this and really opened up some of the opportunities to share information virtually. Also knowing that sometimes Wi-Fi and bandwidth is a challenge in different communities. And so while there may be more opportunities to do virtual physical activity or exercise classes, and many pilot sites started doing more of those. And so what they found is that sometimes the reach was higher than having something in person where people physically had to, get to a location and do it. They were able to have more people participate because they could turn on their computer and do it in their living room, or maybe their kids are doing it with them. And so that really opened up the access to the number of people included, but knowing that also sometimes the Wi-Fi, the bandwidth piece could also be a challenge within that. So I think with rural communities, and this is part of why we provided everyone with here's the Move Your Way campaign and had really specific conversations with all of the pilot sites of what do you think will help reach your community the best? And how do you want to set it, what do you want to do for launch? And what do you think might be activities that will resonate? And what are the community places where they're already being used, the library, the schools, the parks, the trails, and things like that. That was part of the intentional work that was set up initially. Kate, do you want to add any pieces from at least kind of that rural lens and thinking about how we implement in those different populations?
Sure. None of the communities specifically focused on farmers, but I know, Streeter, Illinois is a community about 90 minutes, I think it's southwest of Chicago, but it's like 13,000 people. So it's a very small community. And so they were doing a lot of activities. They focused on kids. So they did some activities surrounding playgrounds and stuff like that. And then I also know some of our other rural areas did have a little bit more of a focus on kids. But I will mention that South Dakota, Healthy South Dakota is an organization that is working on some Move Your Way initiatives specific to some very rural communities, but also to some Native populations, American Indian and Alaska Native populations that live in South Dakota. So I also encourage you to look them up. That's Healthy South Dakota, because they're doing some really interesting work to take what we have developed federally for Move Your Way and make it specific to their very rural population. And so some of what they're doing may be easily transferable to where you are, or might give you some ideas for the communities you're working in.
Yeah, thanks for mentioning that, Kate. I do want to mention that Healthy South Dakota did publish their very own Move Your Way community playbook that has been totally tailored for their community. So if you're interested in checking that out, I will pop the link in the chat. But that also just shows, how adaptable Move Your Way is. So now I just want to shift lenses a little bit and ask a question about some of the results. So unexposed individuals I saw had a greater number of minutes of aerobic activity per week and were more likely to meet the aerobic recommendations than those who were actually exposed. But then exposed individuals were significantly more likely to meet the muscle strengthening recommendations. So do either of you have, any thoughts behind why that might be?
Yeah, we had lots of conversations about those findings. And one of the really interesting things that wasn't on the slides, but that is in the manuscript, is that people who were exposed to the campaign reported more days a week of aerobic activity. So the way that that variable was calculated was they said how many days a week they do aerobic activity and like the average amount that they do on any given day. And then we multiplied them. And so people who were exposed to the campaign reported a greater number of days of being active, but overall had less minutes. And so we think that this is something that requires a lot more research, but could potentially point to this kind of shift that Move Your Way may be having for people of, oh, lots of things count. I'm actually getting active more often than I thought, and then responding to the survey in kind. One of the really interesting things that can do then, especially for contemplators, is, it's really hard to make a change and go all in and be doing everything perfect and then keep it up forever. We've all tried that with various health or habits of our life. And, you do well for a couple of weeks and then it falls apart. We all know that. And so making those little changes and potentially getting active a couple more days a week, even if your minutes aren't increasing over time, may help to improve overall physical activity rates. So more research needs to be done there, but it's not, I don't think it's not fully unpacked how the campaign may be impacting, how people are reporting their physical activity. Katrina, anything to add there?
No, I think you said it perfectly. It was one that we kind of scratched our heads at a little bit and kind of were like, oh, it's a little surprising. But I think if the frequency of the days and doing this over time, the benefits tend to accumulate. And the idea is to kind of adopt more physical activity as kind of a practice, and that it kind of fits into your day. And so what we're taking kind of the encouraging lens on this, that maybe they're just doing something maybe a little bit, but starting to build so that it becomes a regular part of their lifestyle. And in theory, you're moving people towards that 150 minutes or more. But the muscle strengthening piece, I will say, is great. That's a piece that often tends to get overlooked sometimes, that we talk about the aerobic part, but there's a lot of benefits to muscle strengthening, especially as you get older, thinking about the bone health, bone strength, just being able to maintain functional ability. So that was a really great part that we were seeing on the muscle strengthening side.
Great. Well, we are just about out at time. So I want to thank you both for being here. Super informative. And I want to thank everyone for attending today. As Katrina said, feel free to reach out to our Move Your Way team at any point if you're interested in using our materials or customizing our materials in any way. And also look out for a post-webinar evaluation that will pop up in your browser once the webinar ends. So thank you, Katrina and Kate, once again. It was a pleasure. And yeah, thank you all. And Nicole, you can go ahead and end the webinar.